Hi, this is Tammy James. I am going to be doing a comprehensive diabetic foot exam. This gentleman is a 59-year-old male patient that's had diabetes type 2 for about 5 years now. First, what I'm going to do inspection. Make sure any hammer toes or bunions. In that case, if he does have hammer toes or bunions, that would mean he have ill-fitting shoes. Inspect his shoes too. If he does, it can end up causing a callus, and eventually the callus can peel off and cause an ulcer there. Any curved toes. His toes look great. His middle toe here has a little curvature there, but no callus. Also on this foot, all of his toes look great, all except for this one too. A little curvature there. That needs to be inspected probably 4 times a year just to make sure that there's no callus that develops there. Equinus. What we're checking for is the heel cord. And I'm going to bend his foot backwards. And if it's less than 90 degrees, that would mean that would mean he's putting more pressure on the top of his foot there. And the more pressure he puts there and not distributed like it needs to be, he can develop a callus and eventually an ulcer there. The plantar flex metatarsal, which is checking the bottom of the foot. And what this right here is, we're checking the bones right there to make sure that they're flexed, which they are. Now, if he does not, it would appear to be like this. And eventually, it puts a lot of pressure there on top of the foot. Again, a callus. Same thing on this foot. Everything looks great there. He does have a flexion there. There's no decrease in flexion, and so he doesn't have any issues there. Next, what I'm trying to check for is what they call Charcot deformity, which is if he does have deformity there, it would basically mean a collapse of the arch. And the thing about this is that it is not painful. Again, if a patient does have neuropathy, the patient will not know about this, and the distribution of the weight of the foot can cause calluses and ulcerations there. Check for any amputations. If he does have an amputation there, the redistribution of weight can cause a callus. Any previous ulcerations, he does not. Ulcerations usually come back in the same area that it was before. Skin exam. First one I'm going to check for is what they call tenuous pedis, which is athlete's foot. And it can occur in between the toes and on the bottom of the foot. It's real itchy, red, dry skin. In that case, basically what that is, it's a fungal infection, and that needs to be treated. If it's not treated, it can spread anywhere on his foot, and ill-fitting shoes, it can cause calluses and ulcerations. Check for dry skin. Check for cracking. Heel's just a little bit dry. Their skin just dry there. And a little bit of cracking there, but it's just basically dry. And also on this foot, just a little dry. Gangrene or previous ulcers, again, he does not have any of that. Check for the nail beds. Check for the nails, any ingrown toenails, any discoloration around the toe, any thickening of the toenails, which again, it would mean that he would have a fungal infection, which he does not. Check for the temperature of the foot. If it's warm or cold, if it's cold, more or less, basically the circulation is not what it's supposed to be, and again, it can cause calluses and ulcerations. Next, what I'm going to do, I'm going to check for the vascular of the foot. Check for the dorsalis pedis. There is good on this side. Everything's good. And next is what they is the posterior tibula. It's back of the ankle. Everything's good. If the pulses are not prominent, it would basically mean that the vascular is poor in his foot. And again, if it is poor, we can definitely have it checked out again with what they call an ankle brachial index, which would really have a significant impact on the diagnosis of circulatory system in his foot. Check the capillary refill. I'm going to hold pressure on his big toe. There you go. There you go. And blood should return within like 3 seconds. If it does not, again, the vascular has a problem there. Feeling on top of the foot. What I'm going to do, this is a microfilament. It is a 10 gauge microfilament, and it bends. I'm going to put pressure until it bends, and when it does, that's when he should feel it. I'm going to touch top of his leg, and I'm going to let him know this is what he should feel. Do you feel this?
Yes.
Okay, I'm going to start at the top of his big toe and move on.
Yes. 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 Yes.
Okay, the other foot.
Yes. 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 Yes.
Okay, all right. That's good. That's the most sensitive test for neuropathy. If one or two areas that he cannot feel, that would be the beginning or a sign of neuropathy, which you definitely need to be checked out like every 2 to 3 months to make sure that he doesn't have any calluses or anything developed there. Next, what I'm going to do, I'm going to use a tuning fork. I'm going to hit it on the palm of my hand and put it on the top of his toe. Now, he should tell me whenever he stops feeling it. Now, do you feel that?
Yes.
Okay. Now, if he was to stop feeling it and it continues to vibrate in my hand, again, that is a sign of neuropathy. And again, that needs to be checked out. Neuropathy is progressive. This is a more the microfilament is a more sensitive test, and this is not as sensitive as a microfilament. Again, neuropathy is progressive. Okay. Next, what I'm going to do, I'm going to check for the light and dull sensation. I have a cotton swab here. I'm going to rub it on the bottom of his foot, and you can tell me if it's hard or soft.
Soft. Hard. Soft. Hard.
Okay. All right. And next, I'm going to check his reflexes. And this is right here behind the ankle, and this is a deep tendon reflex. And if he does not feel this, deep tendon reflexes are diminished whenever they have neuropathy. Okay, good. All right, and that concludes the foot exam.